What's the different part?
Good afternoon, everyone, and welcome to our Tuesday afternoon training from Green World, Toronto. Thank you for showing up. And today we are privileged to share with you a topic that is important, especially when it comes to brain health. So this is the Green World Brain Care Package that we are going to share and discuss and find out how we can keep our brains healthy for a long time. So Green World Brain Care Package is the topic today, and I'm your presenter, Dr. Charles Waana. The human brain is where wisdom generates. It is where empathy also comes from, and even love takes the shape. As for speed, humans cannot catch even the slowest animal in the savannah. As for strength, humans cannot even hold 1% of what an elephant can hold with its trunk. As for vision, humans cannot be compared with the eagle. And when it comes to swimming, humans cannot stay inside water longer than a turtle. But what makes humans rule the world? That's the question. What makes humans more powerful and can rule the world? Yes, it is the brain, and it is the most precious gift by nature, and some say by God. Clinically, brain health is interesting because when it comes to brain death, this is still the legal definition of death. And brain is the most sophisticated part of the human body. So sophisticated that it has lots of wirings and nerve endings and all sorts of very, very intricate connections. Let us see a diagram of the brain structure to have a clear understanding of different contents of the brain and what each and every part does. So you can see here, the cerebrum is this part here. which consists of the parietal lobe, the occipital lobe, and frontal lobe. And then we have the cerebellum, which has all these interesting parts also, pons, the medulla, which is the brain stem. And then of course, we have the spinal cord emanates from there. Now, let us watch a small video clip to have an understanding of the different contents of the brain and what each part does. So let me share. This is the YouTube. That's the link of this video I'm going to share with you.
What are the different parts of the brain and what do they do? The brain controls everything that we do and how our body functions. It sends electrical messages along the spinal cord and the nerve fibres to all parts of our body. The nerve fibres also bring electrical messages back to the brain. The different areas of the brain control the different parts of our body. The largest part of the brain is called the cerebrum or forebrain. The cerebrum is divided into hemispheres, the left and the right hemisphere. The left hemisphere controls the right part of our body, and the right hemisphere controls the left part. Each hemisphere is further divided into 4 lobes. The frontal lobe controls our speech, problem solving, movement, personality and sensations. The temporal lobe is where we process sounds and where our memories are stored. The parietal lobe is where touch, temperature and pain is processed. It's where we recognise objects and process information when people speak to us. The occipital lobe processes what we see. At the back of the brain is the cerebellum or hindbrain. The cerebellum controls our balance, posture and coordination. The lower part of the brain is called the brain stem. It controls functions that we don't usually think about, such as breathing, sneezing, coughing, swallowing, and our heartbeat. In the middle of the brain are the pituitary gland and the pineal gland. The pituitary gland makes hormones that control lots of different body functions, such as our growth and the production of sperm and eggs. The pineal gland makes the hormone melatonin, which controls our sleep. Around the brain, we have a collection of bones called the skull and membranes called meninges. The meninges support and protect the brain. A clear fluid called cerebrospinal fluid runs between the meninges. The cerebrospinal fluid, or CSF, is made by tissues that line the brain ventricles. The CSF flows in and around the brain and the spinal cord. It protects them from injuries and provides nutrients. For more information about the brain and cancers that affect the brain or spinal cord, go to cruk.org/about-brain-tumours.
Okay, so that was a video clip that shows some understanding of some different contents of the brain and what each one does. So you may be interested in different parts of this brain and find out some of the health issues that some people may have, depending on what part or what particular location of your brain is having a pain or some issue. Now, because the brain is responsible for so many functions, it uses about 20% of the total oxygen and blood in our body and is highly sensitive to lack of oxygen. Lack of oxygen in the brain for about 5 to 10 minutes can result in permanent brain damage. That's why it is so important to make sure that you have a constant supply, you can inhale in oxygen, and your blood supply is flowing efficiently in your body, especially to the brain, because 20% of what you have as oxygen, total oxygen, and blood is consumed by your brain. So the brain is a highly consuming organ in terms of resources. Now, since the brain is so important, today we are going to share 3 common diseases that are closely related with the human brain. We shall talk about the stroke, which is a disease that occurs when the blood supply to our brain is suddenly cut. We shall find out why this happens and how it may happen. We shall also look at dementia and Alzheimer's disease. This is when our brain itself does not work properly. And then we shall talk a little bit about insomnia. And when this happens, our brain cannot work properly also. And so most of the people cannot sleep, cannot have good quality sleep. So we are going to talk about these common closely related diseases of the brain. Now, here, when any one of us comes across such a circumstance where a person suddenly has a drooped face, or cannot move one of his or her limbs, or has a slurred speech, or all of a sudden doesn't recognize one of the very familiar family members, the first reaction we should have is that this person is having a stroke and we should actually seek immediate medication. No time can be wasted, and don't try to give the patient any product. Why? Because I'll tell you, you don't know right now, and you are unable to distinguish whether the stroke is caused by a blocked blood vessel, or a busted blood vessel. That's why it's important not to give the patient any product when this happens, when the person is feeling headache or weakness or numbness on one side, or the face is drooping, or they have slurred speech. Sometimes they don't have good eyesight, so they have blurred vision. And they may also lose consciousness and lose even balance. So these are all signs of a person who may be having a stroke. 1 in 6 people worldwide will have a stroke in their lifetime. Yeah. A stroke is caused by a blocked blood vessel. And most of the time, this blood vessel is an artery and may result in area of the brain that is supplied by the given artery and is deprived of the blood because of this blocked blood vessel. This condition is called ischemic stroke. So when you have a blocked blood vessel, then you may start to have this ischemic stroke. On the contrary, a stroke can be caused by a busted blood vessel, which may result in the blood accumulating in the tissue around the rupture. Just like here in this slide, there may be area of bleeding because of a busted blood vessel. Now, This puts pressure on the brain and causes a loss of blood to the surrounding area. This kind of stroke is called hemorrhagic stroke, where you have weakened vessel wall that can rupture, causing bleeding in the brain. So those are the two types of strokes. The ischemic stroke, when you have obstruction in one of the blood vessels, and so there is lack of flow of blood to the brain. That is ischemic. But when the blood vessel is ruptured or busted, then there is hemorrhage that takes place, the bleeding in the area, and this causes pressure and causes a lot of damage. Now, what disabilities can result from a stroke? As a green world distributor, what we can do for such a patient is to give him or her some nutritional support during the rehabilitation after the treatment, the initial treatment of the stroke, to prevent the reoccurrence of the stroke or heart attack in the future, and to try to accelerate the rehab process. So when somebody has a stroke, these are some of the disabilities they may have. Paralysis or problems controlling movement, for example, arm movement, hand movement can be restricted, or sensory disturbances, including pain. So these may affect some of the parts of the body, and you have impaired balance and even speech because you can't articulate very well the tongue and so on. There can also be problems using or understanding language. This is speech could be reduced. You may start to lose memory of some of the words, or construction of sentences may be impaired. There may be also problems with thinking and memory. So people may start to lose memory of the people, the names of things, the names of people around them, and so on. There also could be some emotional disturbances, and the person may start to be unstable and start to act out of character, and so on and so forth. So these are some of these disabilities that can result from a stroke. And so, as I said at the beginning, as a green world distributor, what we can do for such stroke patients is to give them some nutritional support, which I'll talk about in a few minutes later, during this rehab process, in order to prevent a reoccurrence of this phenomena, the stroke, or sometimes the heart attack may accompany these kind of things in the future. So we try to accelerate the rehab process by giving them some of the nutritional supplements in green world. Now, some stroke perhaps is the most devastating. So stroke is not an easy occurrence for family members. It's the most devastating disease for family, because the patient not only turns from maybe a breadwinner or bread earner to bedridden, so from a provider to a care receiver. But this brings the family an endless financial burden, because the caregiving can span even decades, weeks, and years, because the person may be now in a wheelchair and so on. Besides, caring for an old patient who doesn't express himself or herself clearly or can't even move is a very demanding job. So this could add insult to injury to the caregivers and have even negative impact, both physically and mentally or emotionally, on the caregivers. So stroke is one of the most devastating things that can happen to a family for this reason. And here we have some products that can be used for prevention and recovery of a stroke that we have in Green World. So prevention can be to control the blood pressure. So here we have cardio power capsule, which is in the United States office. We also have coenzyme Q10 and blueberry super nutrition. These products are the base for controlling your blood pressure. To control blood lipids, which is part of the reasons why most people end up with a stroke. So we have lecithin capsule, we have hemp seed oil or omega-369 or super omega in the United States. We also have chitosan capsule that can help control some of the lipids and fats in the bloodstream and try to limit and flush out some of these lipids. We also have slimming capsule. We have lipid care tea and coding plus tea. All these products in Green World can help to control the blood lipid. To control blood sugar, which is for diabetics, and before I go any further, I would like to emphasize that having diabetes, type 2 especially, or even type 1, is very, very dangerous. It is one of those diseases that somebody can easily have a stroke because diabetes starts to destroy some of the blood vessels and the organs that help to make the blood flow in the body efficiently. So to control blood sugar, we have the glucoblock capsule, which is in the United States. You can order it from the United States. We also have balsam pear tea. And then, of course, we have also chitosan capsule. These are the basis for controlling blood sugar. Now, for a person who has had a stroke, they also have to undergo this rehab process. And there's no better way than to support them nutritionally by giving them some of our products, especially spirulina capsule and the blueberry super nutrition. So this will help them have most of the nutrients that they need to make sure they recover from the stroke and all these disabilities that I talked about. Okay. Now, so in other words, in Green World, prevention is better than cure. So if there is a cure for stroke, but these are the products that can prevent and prevent the reoccurrence of a stroke and so on. The products recommended for prevention and rehab to a stroke patient are the same. So acute stroke is dangerous. I just want to make sure you understand that acute stroke is a dangerous condition that requires immediate medical treatment. Don't lose precious minutes trying to give the patient some of these products. You have to make sure that the patient gets attention immediate from the hospital, the doctors. Then we can have the nutritional supplements that are used to support the recovery from the stroke rather than to treat an acute episode. Things like coenzyme Q10, essential fatty acids, lecithin, vitamins, and some herbal remedies are considered beneficial to stroke recovery. Okay, so you can see these products that I have listed on this slide. They are the Green World Brain Care Package. That is what you can use to help stroke victims. Now, how we can control blood pressure? By lowering high blood pressure, you reduce the chances for a stroke. So that's why it's very important that we control the blood pressure. So stop smoking. Cigarette smoking is linked to increased risk for a stroke. Also exercise regularly. Moderate exercise makes the heart stronger and even improves circulation. It also helps control your weight, thus it can reduce the risk of stroke. So exercise on a daily basis is so important to prevent a reoccurrence of a stroke or to prevent the stroke happening to you. Also, eat healthy diets. Eat a variety of fruits and vegetables. Eating a healthy diet is probably the most effective way of keeping a low stroke risk because it can protect you from developing high blood pressure, diabetes, high cholesterol, obesity, and so on and so forth. So if you are diabetic, you should control your blood sugar level. If left untreated, diabetes can damage the blood vessels throughout your body and can lead to atherosclerosis, which increases the risk for a stroke. So that's why I was emphasizing that for those people who have diabetes, they should monitor their blood sugar levels on a regular basis because diabetes is a silent killer and it can increase the risk of strokes. So lots of people who suffer from strokes are actually also suffering from diabetes. So stroke is actually an emergence, but one of the consequences of having stroke is another brain disease that silently occurs that we really or rarely notice at the beginning. It begins from forgetfulness that we believe is part of the aging process. So a lot of people, when they start to forget certain things here and there, they say, oh, that's part of aging, I'm getting older. So it's no problem, that's natural. But it ends up in some cases in severe brain damage. This disease is called dementia. Since Alzheimer's disease is the common form of dementia, so we shall discuss about these two diseases together. Let us have a general idea of this dreadful disease, dementia, forgetfulness, and so on, memory loss. At the early stage of this disease, the people tend to forget about the food they just ate. They don't know, if you ask them what they ate, they have no idea. Now, in the middle stage, or middle stages of dementia, when a person visits their old friends, they may not have, or they may find it difficult to articulate and bring out the right words and discussion to chat with their friends. Okay, so this is the middle age. But if you let it go on at the later stage, when perhaps your friend comes to your house, you may not even recognize the person, the name, who she is, who he is. These are the late stages of dementia. You even can forget who you are when you have dementia in the later stages. And you may even not remember where your house is. So if you make a mistake of going out and walking, taking a walk in the neighborhood, you may not even know where your house is. So you end up getting lost. This happens a lot. I see a lot of police notices about somebody who disappeared, somebody maybe in their 70s or 80s, went out and was never able to come back to their house. So the members of the family are sometimes concerned because this person they notice doesn't have good memory. So this is dementia behavior. Okay, so you may not be able to find your house if you have late stage dementia. A long term of insufficient blood supply is one of the causes of dementia or Alzheimer. So if your body doesn't have good blood supply, this may also as I said at the beginning, 20% of your blood supply and oxygen that you have in your body is consumed by the brain. So if you don't have sufficient amounts of blood to your brain, it starts to die. A lot of cells start to die. And free radical attacks also start to damage your brain cells. Vitamins and fatty acid deficiency can contribute to this condition as well. So that's why it's important to start taking healthy diet. Try to eat as healthy as you can to delay the onset of these deadly brain diseases like dementia and Alzheimer. Here are some of the products that we have for dementia and Alzheimer disease. So to improve your blood supply, we have ginkgo biloba capsule. This, I think, could be in the United States, but I know it's in other markets like Africa. Then to protect the neuron and anti-inflammatory so that you avoid the free radicals that bombard your brain cells and so on. You need things like deep sea fish oil, or you need hemp oil or omega-369. This will protect your neurons and become anti-inflammatory agents for your brain. So that's why it's always important to take your hemp oil on a regular basis, omega-369. Also, we have raw materials of neurotransmitters in the form of lecithin capsule. Lecithin is in the United States market here. So you can always order that kind of product. Also, to produce energy for your brain, you need a coenzyme Q10 capsule. So make sure that you take your Q10 capsule also on a daily basis. This will give your brain a lot of energy and protection. Also, to reduce free radical damage in terms of having antioxidants, we also have the blueberry super nutrition. So once in a while, you should be taking your blueberry super nutrition, which is antioxidant. And you have the anthocyanins, which can cross the brain-blood barrier. So that barrier, some anthocyanins are able to go through and protect your brain. So that's why we emphasize the blueberry products, blueberry juice, and so on and so forth. For nutritional support, of course, we have our lovely spirulina capsule, which is the superfood and provide you with a lot of nutrients that the brain may also be lacking. So that's why spirulina is so important to take on a regular basis. So those are the products for dementia and Alzheimer disease, how to prevent, how to slow down the progress of those deadly diseases. Unfortunately, there is no cure for dementia and Alzheimer's disease so far, but we can definitely do something before it progresses into the middle or late stages. That's why we have these kind of products available. And we want you to have access to them and improve the lives of people with dementia and Alzheimer. And if they are in your family, then these are the products that you should be giving to those members of the family. How to prevent dementia and Alzheimer's disease. So these are some of the things that I want you to take away, how to prevent dementia and Alzheimer's disease. So the first one is have a healthy diet, including low fat and high fiber food like fresh fruits and vegetables. This will protect you from attacks of cerebrovascular diseases, okay, because they're loaded with good nutrients. Also, have regular exercises, because this will lower your risk of developing dementia and Alzheimer's disease by making your heart and blood circulatory system more efficient. The more you exercise on a regular basis, the better your blood circulation system will be. It will be efficient, and you will get the flow of blood to the brain in good amounts. Also, moderate taking of alcohol is advised. Don't binge drink, and quit smoking if you're a smoker. This is the best way to protect your blood vessels and reduce the risk of dementia and Alzheimer's disease. So alcohol and smoking should be controlled. Also, to remain as mentally and physically active as possible throughout the whole life, and have a wide range of different activities and hobbies, which will help you to reduce the risk of developing neurodegenerative diseases. So this is so important. Don't follow that lifestyle. When people retire, most of them, that's it. They just stay home and they have no activities to do. They just no hobbies, and they just slowly sink into depression. And eventually the brain also, which is a muscle, it starts to atrophy. And so this is why we have dementia and Alzheimer's disease, mostly attacking people who are not active, who are not exercising, and they are not having even healthy diets and so on. So it's so important. Don't stay sedentary, that life of just sinking in the couch and that's it, and waiting for something to happen. So your body also deteriorates, and not only your physical body, even your brain starts to get damaged, and so the cells starts to die, and so you start to have these memory loss issues. All right, so now I'll talk about insomnia. Adults spend about 1/3 of their lives sleeping. And babies and toddlers, probably they sleep away half of their early childhood. It cannot be the terrible waste of time that it seems when people sleep. Some of this culture here in North America, people are so proud to boast that they only slept for 3 hours or 2 hours, and they're up and the productivity is going. But it is not a waste of time when somebody sleeps. Adequate sleep is crucial to proper brain function, no less so than air, water, and food. Sleep is also as important as air you breathe, the food you eat, and the water you drink. And the scientists believe that our brain appears to reconstruct or restructure information from the previous day during sleeping hours. So sleep disorders can impair the brain function, among which insomnia is the most common one, affecting thousands or millions of people. So insomnia is one of those, is associated with serious health problems such as obesity, depression, diabetes, and some of the cardiovascular diseases. These are some of the outcomes of lack of sleep, called insomnia. So not getting enough sleep leads to weight gain. if you are losing sleep, your body mass index, the BMI, is likely to increase, and so is your waist circumference. There is a hormone called leptin, which tells your brain that there is no need for more food. And there is also a hormone called ghrelin, the hormone that tells your brain that it's now chore time, it's now time to eat. So leptin is produced less and the ghrelin is produced more when we are deprived of good sleep. So that's why when you don't get enough sleep, you tend to put on weight. These two hormones are affected. The one that tells you that you don't need food, and the other one that tells you that now it's time to eat. These two hormones are affected when you don't get enough sleep. Also, insomnia leads to memory loss. The more quickly you fall asleep after studying for a test or learning a new skill, the more likely you are to remember this information later. But if you learn new information and then go about your daily business, you have about a 44% lower chance of retaining what you have just learned. So getting good sleep helps your memory, while insomnia can damage that memory. Insomnia also leads to intellectual impairment. Our brain undergoes a process of consolidation when we are sleeping. If you want a good memory, you need to improve the quality of your sleep. Lack of sleep is also connected to physical impairment. Every driver has such an experience that if they had a poor night's sleep, the following day they really feel like pulling over for a nap. An international cross-sectional survey was conducted across 10 countries, trying to find out the link between accidents and sleep disturbances. It says that people with insomnia or lack of good quality sleep have higher rates of home accidents, car accidents, and work accidents. These are work-related accidents because of the poor coordination and reaction time. So this is very, very important that you get enough sleep. How can Greenwald Eye Shine Capsule help with insomnia? Well, this product, Eye Shine Capsule, is available in the United States, so you can always order it for people who have problems falling asleep or who have insomnia. The sleeping pill is the most frequently used medication for insomnia, although long-term treatment or use can cause withdrawal symptoms or reactions when discontinued abruptly. And of course, some of these sleeping pills can affect your entire liver system and the kidneys and so on, because they are synthetic drugs. The Greenwald Eye Shine is a revolutionary product that induces sleep, or deep sleep, I would say, with sedative effect. It also has anti-neurodegenerative properties that prevent memory loss caused by oxidative stress. So it is a natural product that we can use to help us with our insomnia. And I highly recommend for people who do not have the ability to sleep well, to have insomnia, to start using this Greenwald product, Eye Shine. You can order it online if you're in Canada from the United States office. So, in conclusion, a healthy brain is the fountain of wisdom and solutions and happiness. An unhealthy brain is the source of trouble, problems, and sorrow. So if you want to have a happy life, you should start nourishing your brain with nutrients and protect it with the Green World Brain Care Package that I have just shown you. So this is so important. So this is the product for dementia and Alzheimer's disease. Those are the products that you can use to prevent and also to slow down the progress of such diseases. Then we have also the products here to prevent or to help people who have had stroke during their rehab process. We have here the list of products that we can use. So these are the things that I share with you this afternoon regarding the brain care, that sometimes you may not be lucky and a member of your family may have a stroke or may start to have these memory issues like dementia and Alzheimer. And it's always a good idea for us to be able to have some of these products to help them recover and slow down some of the progress of things like dementia and Alzheimer. Okay, so that's it. Thanks all of you for your patience, for coming and showing up for this presentation. So I'll let you be able to unmute yourself and be able to ask questions. All right, so if you have any question or if you have anything to share, testimony about brain care, dementia, Alzheimer, insomnia, this is time for you to unmute yourself and then share. If you have a question, we shall try and answer that question for you.
Okay. Hi, Dr. Waana. It's Yvonne Flynn. How are you?
I'm fine. How are you, Yvonne?
I'm good. Thank you. Thank you. So, okay, so these products can be taken, for instance, if the person has the Alzheimer, which is the end of the dementia spectrum, right?
Yeah.
It's where it goes at the end. And if they are already on prescribed pharmaceuticals, if I'm going to call that, they can take these products alongside with that as well, right?
Yes.
Is there any? Yeah,
Yeah,
okay.
they can. As long as
Yeah,
there's
because
space out so that they don't interact.
right. Because it's really quite prevalent, I'm noticing, right? So many people are complaining with, I just had a friend yesterday and she just discovered that her mom is getting into the dementia.
Yeah.
And she's out of she's really frazzled, if you want to call it that. She doesn't know what to do about it. So I was telling her about the Green World products, and I especially was mentioning the what do you call that? The blueberry plus,
Yes,
right?
blueberry. Yes.
But we actually have a package that I could tell her about, not just the blueberry plus.
Yeah, yes.
Okay, I will do that. Thank you, Dr. Wan. This is a very distressing but still a very important information session, and I'm glad that at the end of it we were able to have some hope.
Yes.
Right? It's always good to have that. Thank you so much.
No, you're welcome. I know that the Alzheimer and so on there is no cure yet, but you can do something to slow down the progress of the disease. So some of these products are very good at doing that. So that's why I showed you those slides of the products. Yeah. All right. Anybody else? Molly?
Sorry. Nothing to say.
Yes.
I'm sorry. I just unmuted by mistake.
Oh,
Sorry.
okay. Okay, sorry.
Yeah.
Okay, so anything else? you can, some of the products are in the United States. For those people in Canada, can always order online. The things like eye shine and Lestine and so on. So, all right. So it looks like everybody is ready to go out and share these interesting products with people, your colleagues, your family members, and you yourself also included. So let us share and care and be able to heal ourselves naturally. All right. So have a nice evening. I will not be able to do the presentation next Tuesday, but the Tuesday after that, I'll be back and maybe try to change the time to a later time, like 7 or so. Trying to work on that as well. But thanks for coming, and I hope you took away something that can help you and help other people. All right, thank you, and have a good evening, everyone.